Hello everyone, I am Dr. Mohal Banker from Banker's Vascular Hospital, and today we are going to discuss about the case of the leaf vascular malformation, how to treat it. So this is a classical case of slow flow venous malformation into the lip region. This is MRI. The upper lip region right now is absolutely normal, but from this slide the small lesion is already started. Gradually the entire upper lip is involved into the midline, and these are the lesion involving the upper lip portion. And in axial section we have a better view that entire this upper lip is involved and it is extending on the left side. So for treating such kind of lesion we are doing the absolute ethanol embolization. So what we do it, so first we directly puncture the nidus, and these after punching the nidus we just measure the volume of the nidus. So these are nidus, and roughly 3 to 4 cc volume of these nidus, and once we inject more and more contrast, then more contrast is filled up and goes into the normal blood vessels, which is very well visible over here. So these are nidal region, and these are the communicating normal venous structure. So by doing this we have roughly idea about how much volume of ethanol is needed to inject in this nidus, and after deciding the dose of ethanol we inject ethanol very slowly. And let's have a look on this ethanol injection. So here these are nidus and these are negative contrast effects. So this white portion is the ethanol. So we inject the ethanol till the date that it will not go into the normal circulation. Once we find it out the nidus is filled up with ethanol, we stop injecting ethanol. And this is very important thing, because there is no standardization flow rates, and there is no standard technique to inject the ethanol. But that's why you need to develop your experience. That's why ethanol injections required a little bit more and more experience. So you should go for in the center where the absolute ethanol embolization treatment is doing very frequently. And after injecting this ethanol we do the check angiography, and these are check angiography, and you see there's this nidus is little bit shrunken in the size. And this is what we want, that after injecting ethanol nidus should be destroyed, and on angiography it little bit reducing into size. So these are one injection of ethanol. Similarly we inject more and more ethanol into the same nidus, and at one point nidus completely shrunken, not accepting more contrast, and that is the end point for our treatment. So absolute ethanol embolization is a gold standard for treatment for any kind of vascular malformation, because the basically we are eliminating the nidus from this from the lesion, which is a main culprit of the lesion, and we are preserving the normal structure. Like in this case we are preserving the upper lip, just the abnormal portion into this upper lip. This is a vascular malformation, that portion we are destroying. The rest of the muscles, rest of the soft tissue is remain intact. And there is a beauty of this procedure, that we are not damaging the normal area, we are just eliminating the abnormal vascular malformation lesion. So hope you understand how we treat this such kind of lesion. If you have any kind of question, if you have any kind of doubt, do ask us. I would be very happy to answer all your questions, and thank you so much for listening this video.